Thank you, Mark. I think it was an ideal introduction to my talk, what you just said. So it puts me on the road. I must admit now that in this stage of my life, my interest is more in technology and gadgets and computers and less in clinical cases. We had this for 40 years, so now we try to move on. So I would like to introduce to you or tell you about some new novel technique that I'm involved with the last 2-3 years. And this is the automatic strut for the hexapod frame, and we'll continue. Okay. So everybody knows that, as Mark mentioned, that external fixator are the first line, hexapod external fixator are the first line of treatment now for bone lengthening, complex fracture, limb lengthening, etc. And it is based on circular rings and 6 adjustable telescopic struts, wires and pins fixation, can be applied to the upper limbs, can be applied to the lower limbs, can be applied to the feet. It's much used in many fields. The adjustable struts can correct deformities and correct and lengthening bones actually in 4 planes of motion, if you include AP lateral rotation and lengthening. So it's a very sophisticated system where you can do what you want in the same time. But there is some drawback to this system. You are relying on patient. You are relying on your patient to do the adjustment. You must explain to your patient how to do the adjustment, and you must see that your patient is doing it correctly, according to a plan that he gets when he starts the treatment. And basically, it's not more than 1 millimeter, not less than 1 millimeter per turn, because this is what you can do manually. Patient has to follow, or the patient or the caregivers of the child has to follow the program and the schedule, and to be correct and to be in time. So here comes the idea to replace the manual struts or the adjustment of the patient or the relying on the patient, the corporation or caregivers, by an automatic system. Now we are in the 21st century. Computers and automation is our life now. Why not doing it also in the field of deformity correction? So the idea is to produce a strut which has a motor, which elongate or shorten the telescopic apparatus, but it has to be controlled by a controller or computer, actually, which will operate it at the same time. The goals are to produce an automatic system with no patient involvement, which will reduce error, to have a continuous physiological motion instead of 4 times a day or 1 millimeter minimum of adjustment. You can have as much as you like in terms of rate and size of your movement. You can reduce the strut changes. You can save some clinic time. You can have in the future a reciprocal data collection from the struts into the surgeon's apparatus, into the surgeon's iPhone or whatever. The surgeon can have a remote control on the system. And at the later stage, we can add bone healing stimulators like ultrasound and electrical stimulation, because we have an energy source on the frame you can use to do some to put some energy into your bone. The OrthoSpin company is the one that approached me, it's a startup company that approached me about 3 years ago to try and develop this thing. I think we can see what they have to say.
OrthoSpin, developing fixation systems for the orthopedic trauma market. OrthoSpin's smart external fixation system reduces dependence on patient compliance and updates physicians in real time. Often, external fixation is the first line of treatment for complex bone injuries, limb lengthening, and limb deformities. The global market for external fixation is estimated at $800 million. Today, the patient receives a list detailing how often and how much to turn each rod, called struts, to carry out the specific treatment. Caregivers or patients must manually turn 6 different struts up to 4 times a day. 6 struts 4 times a day for 3 months or longer. That's almost 2,160 turns. It's too easy for patients to forget to turn a strut or turn it incorrectly, and doctors cannot monitor patient adherence. OrthoSpin's external fixation system connects patients, doctors, and hospitals to accurate information. The system's smart strut receives instructions from a lightweight control box and turns the struts automatically to the exact positions prescribed. From this point on, there is no longer need for manual adjustments, as the system is fully automated. The system sends real-time updates directly to the doctor's mobile device or computer. Accurate adjustments, real-time feedback, and reduced costs are just a few of OrthoSpin's benefits for patients, doctors, and hospitals. The system is compatible with existing external fixation frames and can be customized to meet specific requirements. OrthoSpin.
So the management team, as it stands now, we have 2 engineers here, this one, and there is Dr. Deckel, is the director in charge of public relations, I should say, and this lady is in charge of getting the licensing and so on, registration. The scientific medical advisory we have Scott Nelson here, myself, and you can see the others. What we have now actually is the 2nd generation here. It looks like that. It was the beginning was this structure, but now it looks like that. Part of the system, part of the work was done at my house, in my workshop, just to show you. And I can show you how it works now.
עלייה והורדה של 15 מילימטר.
Okay, we'll carry on. So we got an IRB approved study at Tel Aviv Medical Center to do 10 patients, starting last year, beginning of last year. And this is the first case report that I can give you that was done. This is a boy of 14 and a half. He had adolescent gynovirus with VOS of 18 degrees, internal rotation of 8 degrees and shortening of 20 millimeters. We started by applying just standard tailor frame. The surgery was done with the tailor system, just applying standard tailor frame. We pulled out the program. You can see we have the 6 numbers to start with and the 6 numbers to finish with. We translated it into the OrthoSpin system, introduced it in the OrthoSpin system for their controller. We actually divided this just to see how it works for much smaller increment of work, 0.125 millimeters each one. Then we introduced this tailor frame into the smart struts here. You can see it here during lengthening. And this is final position. After lengthening, everything worked well, corrected the deformity. This is how it looks on the leg. You can actually see it how it works. Sorry. You will see it turning by itself. It gives notice, so it won't wake you up. Okay. So we've seen 1 month, we got the bone deformity corrected with all the parameters. Patient function was good, and minimal, no complication with minimal pain. We can say that the automatic strut procedure was compared to manual operation actually better in terms of patient comfort. It was accurate and reduced patient involvement. The system at this stage can monitor the patient compliance because you can see what is actually happening on the patient. You can see how much movement done in millimeters. You can see the date on time. If there are any error events, overcurrent, overvoltage, and so on, any technical problems, and you can measure the force used. You can measure the force used to distract your leg. The regulation, as it stands now, it is in an FDA application for approval. I think it's in the middle of the process of the 90 days of certification. Future roadmap for future improvement is that we will reduce the size of this controller, which is very bulky. It's already done. We'll try and get more size on the strut. It's now compatible to medium and long of the Taylor frame. We would like to have a wireless system, and then there will be a smartphone application for data collection, daily reports, and control by the surgeon. This is how it looks now. We have divided the controller into three. Each one controls 2 struts. It's much smaller and much more comfortable. This is how it looks now. As it stands now, there are investors in the company, Johnson & Johnson, especially, and $3 million from Johnson & Johnson. So thank you very much, guys. This is, I think, the future, but we'll see how it goes. Thank you.